So this issue that I have before you today is not something that will be new to members of the committee who have served on this committee. You all heard testimony on this issue in the interim from my friend and constituent, Mr. Mike Stoyanovich, who is an Edmonson County veteran and an active member of the DAV at the state and local level. He's a service officer at the local level and serves as an officer in the state DAV too. Mike was unable to be here today, and I feel a little insufficient in his stead, but he had a hip replacement yesterday and will be down for the next 5 weeks, and so his timing was not very conducive to session, but I will do my best with a bill that he has been the driving force behind. Two important statistics from that meeting that you all were in this summer and from the press surrounding it. According to the U.S. Department of Veterans Affairs statistics, in 2020, 119 of the 6,146 veteran suicides nationwide were in Kentucky. And according to the UK College of Public Health, and statistics can be a little different between who is assessing and following those statistics. In 2021, there were 111 veterans that died by suicide in Kentucky. In 2020, 125 veterans, and in 2019, 103 veterans. So you can see that it is a problem that's affecting roughly 100 to 110 veterans a year on the average across the last 3 to 5 years here in our state. We know that the suicide rate amongst veterans is much higher than the general population, and House Bill 30 seeks to start addressing the issue. I would say this bill is a first step and it's not a final destination. The bill is about breaking down barriers and creating communication amongst multiple government agencies and nonprofits. In my humble opinion, the bill has two main goals, and that's reducing the stigma for veterans to access the services and helping to overlay specific help that already exists to make those resources more specific for veterans. The bill creates the Kentucky Service Members, Veterans, and their Families Suicide Prevention Program within the Kentucky Department of Veterans Affairs to operate in collaboration with the Cabinet for Health and Family Services and additional community partnerships. The goals here are to raise awareness and reduce death by suicide amongst our veteran population and their families. Specifically, I think the program can reduce the stigma by inserting veterans in the process, training people at the Kentucky Department of Veterans Affairs to help connect those veterans with services, because we all know that what veterans experience is a little different than what the general population experience. And if they're having another veteran that helps liaison them to those services, I think it's a better way into the door for them. Also, we know that many services already exist, again, through the nonprofit world and through the Cabinet for Health and Family Services and other mental health resources, but they may not have veteran-specific issues to help those veterans with. And so hopefully we can, with this effort, overlay specific help for veterans over the existing services. Like I said, veterans that are at risk face different things. They may face some of the same things. It may be financial problems, it may be family problems, but many times what they're facing, the root cause is PTSD and what they've gone through when they have served our country.